Today's lecture for the phlebotomy technician is Chapter 7, which covers the cardiovascular and the lymphatic systems. There are a lot of key terms at the beginning of the chapter that you should be familiar with, and be sure you know how to use those. And here are your chapter objectives. So the first thing you need to remember about the cardiovascular system is why it functions. And the main function is to transport fluids, water, nutrients, electrolytes, oxygen, all of the cells that you need everywhere that they need to go in your body. It also acts as a line of defense. It helps us with our coagulation and our clotting processes, and it helps you control your body temperature. So these are the parts: your heart, your arteries, your veins, your capillaries, and the circulating blood. So here's a diagram of the heart. You need to be certain that you're familiar with the anatomy of the heart and the vessels. Remember that you have two atria there at the top and the two ventricles, which are at the bottom. And you have the valves in between. The purpose of the valves is to keep the blood from flowing backwards back into a different chamber, so it prevents backflow of the blood. And remember the two phases of the heart's action. You have the contracted state, systole, when the heart is pumping, and you have diastole, which is when the heart is relaxing and refilling with blood. Your heart is made of muscle, and it's about the size of your closed fist. It sits just to the left of your sternum, in front of the left lobe, and the left lobe only has two lobes. The left lung has two lobes because the heart takes up part of that space. The right lung has three lobes. So the four chambers of the heart are the right and left atria and the right and left ventricles, and they are separated by septums that have valves in them. So the way the blood flows through the heart, it comes into the right atrium from the two largest veins in your body, and that's the vena cava, the superior vena cava and the inferior vena cava. The superior brings blood from the upper part of the body, the head, neck, arms, chest, and the inferior vena cava brings blood from the lower part of the body, but they both deliver blood into the right atrium. It goes into the right atrium, through the right AV, or the tricuspid valve, and down into the right ventricle. When it leaves the right ventricle, it starts into the pulmonary circuit, where it's going to go to the lungs to pick up oxygen. In the pulmonary circuit, the deoxygenated blood goes to the lungs. It goes through the arteries, the veins, the arterioles, to the capillaries, and that's where the CO2 gets exchanged for O2. That's where it picks up the oxygen cells. Then it goes into the left and the right pulmonary veins, and then into the left atrium, then down to the left ventricle. And the left ventricle is the strongest part of your heart because it has to pump that blood out to all of the tissues in your body. So you can actually identify the left ventricle in a heart that has been removed because it's going to have the thicker layer of muscle, because that muscle is so much stronger from having to pump the blood out to the body over all that time. Your blood helps you maintain your homeostasis, which is a state of balance. So there are lots of different ways your blood plays a role in that. Number one, it helps you exchange your gases to keep your oxygen levels sufficient. It also helps you with clotting to keep you from losing too much blood. And it also helps to regulate your temperature. You have arteries, veins, and capillaries. And when we're talking about these vessels, know that if you have a weakened area in one of these, a weak spot in the wall, that's an aneurysm. And if the blood pressure gets too high, that aneurysm can rupture and can cause excessive bleeding. Your arteries, think arteries, away. Arteries carry the blood away from the heart. So the blood that's in the arteries is oxygenated blood, and it's carrying out to the tissues. So the arteries go out through the body, and as they get smaller, they are called arterioles. You can tell an artery from a vein because it has very thick walls, and it has a bounding pulse noted in it. And remember that they carry oxygenated blood. Your veins carry unoxygenated blood, and they carry the blood back to the heart to go through the pulmonary circulation to help pick up the oxygen. So it's a little bit weird, but the only veins in your body that carry oxygenated blood are the pulmonary veins. So those are just a little bit backwards, the pulmonary arteries and the pulmonary veins. Veins have little thinner walls than the arteries. You're not going to detect or palpate that pulse in those veins. If you look at the anatomy, the vein anatomy in the arms, which is where you're going to perform most of your venipunctures, the antecubital, inside the bend of the elbow, those are the veins you're going to access most often. And the medial antecubital is the one, the median cubital runs right through the middle of that elbow space. There is a graphic that shows the difference between an artery and the vein. You can see the difference in the size of the vessel and how thick the walls are. And there's between the capillaries, the veins, and the arteries. Your capillaries are the tiniest vessels in your body, and you find them in places like your fingertips and your toes, your eyeballs, and your kidneys. So usually only one cell can fit through those at a time. So if you have capillary bleeding, it's going to be just a drop. If you have venous bleeding, it's going to be slow, kind of leaking, and it's going to be darker red. If you have bright red bleeding that's spurting or spraying, that's arterial bleeding. This picture shows some different conditions of a vessel. Atherosclerosis is hardening of the arteries, hardening of the vessels, and that usually occurs from having plaque built up inside of them. And that plaque is cholesterol and fat, either that your body makes or that you ingest through your diet. So this is why we tell people to eat a low-fat diet, because we don't want that building up on the inside of their vessels, because you can see not much blood can get through that. That second picture shows a little bit of an occlusion, a little bit of a blockage. It's partially blocked. And then the very right picture, it's completely blocked by a thrombus or a clot. There are the vessels in the arm, so be familiar with those, be able to locate those, and know which ones you are going to be able to stick when you're drawing specimens. And know that no two people have identical vein patterns in their arms, so you may have to look. That's why you're going to assess your patients before you try to access any specimens from them. Your capillaries are microscopic vessels. They are so tiny, usually only one cell can get through them at a time, and that is where your gas exchange occurs. There are your different types of bleeding. If you have arterial bleeding, it's going to take a lot of firm pressure to stop that. Venous pressure is not going to take quite as much bleeding. Capillaries may stop on their own or just lightly applying a dressing to those. Now let's talk about your blood. It transports nutrients. It helps dispense nutrients where they're supposed to go. It helps regulate your temperature and your fluid balance, and it helps you maintain your state of homeostasis. This is how much blood is in a typical human. A newborn has about the equivalent of a Coke can worth of blood in their body. A 60-pound child has about the same amount of a 2-liter bottle worth of blood. And a 125-pound adult has about 2 liters worth of blood in their body. So think, if you had a 400-pound man, he's going to need a whole lot more than two 2-liter bottles worth of blood to carry all of the necessary elements throughout his body. So the larger somebody is, the more blood volume they are going to have. But typically, the average size female is going to have about 2-liter bottles worth of blood in their body. And it only takes a half of a Coke can's worth of blood loss to be considered life-threatening blood loss. So we want to be sure we control bleeding as soon as possible. Your blood is made mostly of water. There's some other cells in there also. You also have lipids, which are fats, glucose, which is sugars. You have proteins, fibrinogen, which is your clotting factors, electrolytes like sodium and potassium and chloride. And your blood works to transport these throughout your body. When you collect a specimen, you may want the specimen to form a clot, or you may want it not to clot. You need to know what test you're running to know which type of tube, because some of the tubes have additives that will either allow or prevent the blood from clotting. And if you think about it, the blood drives, the bags that they use to collect the blood, have an anticoagulant in them, and that keeps your blood from all just forming one giant clot in those bags. So you collect the specimen, and you put the tubes in the centrifuge, and it spins them down, and it separates it into different components. So you see there the serum is floated to the top, and it's clear, kind of yellow looking, and then the red blood cells have floated down to the bottom and have started to form a clot. The blue top tubes have an anticoagulant in them, so you can see when that specimen settles out that you have the plasma that floats to the top, you have the cells that clot and clump to the bottom, and in between you get a layer of cells, the white blood cells, that form a buffy coat is what that's called, and it separates the two. If you shook that vigorously, it would mix those back together. In the red tubes, there's no anticoagulant, so the red blood cells are going to drop to the bottom and they're going to form a clot there. And then you've got a serum separator. It's like a gel or a wax that's in that tube. It separates the serum from the clot itself. The different parts that make up your blood, you have different types of cells. The erythrocytes are also known as your red blood cells. And when I show you a picture of them in a little bit, the shape will make sense. It looks like a disc that's kind of dipped in on both sides, and that allows it to change shape and pass through the membranes easier. The red blood cells, or erythrocytes, help carry the oxygen through your blood. So if we're checking your hemoglobin, like they do at the blood drive, we're checking for your erythrocytes to see how much capacity you have for carrying oxygen. The red blood cells live for about 120 days, and you know from working the blood drives that you can replace those in about 56 days, but we want them to grow and mature for the 120. That's when they reach their peak. You have 4 main groups of blood. You have A, B, AB, and O. O is the most common, and then followed by A, B, and AB. And what determines what blood type you are is protein molecules and antigens that are on the blood cells themselves. They look at those under a microscope. So there's a graphic that shows your red blood cells, and you can see how they're kind of concave on the top and the bottom, and that allows them to move about a little easier. There is a condition called polycythemia, and that's if a person has too many red blood cells. And you would think a lot of red blood cells would be a good thing, but if you have too many of them, none of them grow to be mature to be able to carry the oxygen effectively. So I actually had a home health patient years ago who was polycythemic, and the way we treated her, we would go to her house and draw off large tubes of blood and just waste them. So that was drawing off a lot of red blood cells so that her other blood cells that we left her could grow and be good, strong red blood cells. If you need a blood transfusion, that means that blood is being taken from one person and given to a different person. And you do know that your body will reject anything that is not something that is part of it. So I can have a rejection reaction to someone else's blood. The way we cut down on the chance of that happening is we do a very extensive type and cross match. So if you are donating blood to me, they will check your blood for the blood type, and they will check my blood type to make sure that they are compatible. And then they start to do a cross match, and they test lots and lots of different things to make sure that I'm not going to have a reaction to your blood. If you ever see a patient have a reaction to a blood transfusion, it's a very violent reaction and they feel terrible. Their temperature will go up. It usually happens within the first 15 minutes of the blood starting. Their temperature may spike up to 104, 105 very quickly. They have violent chills. A lot of times they get very nauseated and they hurt all over their body. So if you witness a person, if you're transfusing blood and they start to have a reaction, the first thing you do is stop the blood from being given to their body, and you open their IV fluids up, just plain saline, and run it as fast as you can to try to dilute the blood that you have already put in their system. And then you can give them things like Tylenol or maybe Benadryl to help decrease their allergic reaction. Now we're talking about your leukocytes, or your white blood cells. You usually think of those if you think of having an infection. And what happens is, if you have an infectious process going on in your body, you will produce more white blood cells to go to that area to fight off the infection. So that's why if you're running a fever and have a sore throat, the doctor may draw blood and they are looking to see how many white blood cells you have there. If you have a disorder that you have too many white blood cells and they are immature and not effective, that is a leukemia, or a cancer of your blood, and it's dealing with the white blood cells. Remember, leuc means white. You have different types of white blood cells, and if the doctor orders a CBC, that's a complete blood count, so that's going to look for every type of cell in your blood. And they're also going to order a differential to go with that. The differential tells how many of each different type of white blood cells do you have in your specimen. And you have neutrophils, eosinophils, basophils, monocytes, and lymphocytes, and they each have a different function in your body. Your white blood cells are formed in your bone marrow and in your lymph tissue. Then you've got thrombocytes, or platelets. These are the cells that will stick together to form a blood clot. They're smaller and they're a little bit sticky, and if you get any kind of injury, they are going to clump together and stick together to patch and to form a clot to stop you from losing blood. These cells only live 9 to 12 days. The plasma is the liquid portion of your blood. It does not clot. It carries the blood cells because they're suspended in the plasma. It is mostly water and different solutes that are floating around in it. This is a chart that shows the acidity of your blood, the pH of your blood. Coagulation and homeostasis are related because if something happens and you're losing blood, your body can send clotting factors there to prevent any more blood from being lost. So there's a very detailed process that your body uses in forming clots and coagulation. The first stage is, and there's a graphic coming up that will explain it. If you have an injury to a vessel, you get a cut or even a venipuncture, the first thing that's going to happen is that vessel is going to constrict. It's going to try to close itself off to decrease the amount of blood that you lose. Then it's going to start increasing your platelets and sending platelets to that area. Then it's going to release the clotting factors and it's going to start to make a clot. And then the clot is going to stick there to further prevent any bleeding. Then the fibrinolysis happens. It sends fibrin to that area and it actually starts to knit that vessel back together. So there's a graphic of that. You see the injury, You see the vasoconstriction or the vasospasm. The platelets go there, and then the fibrin goes to form, to knit that back together. There are some things that can cause your blood to not clot. If someone is a hemophiliac, they are a free bleeder, and they could bleed to death just from a very minor injury. So you want to watch those people very closely. There are certain medicines that can decrease your clotting as well. Medicines like heparin or Coumadin, or even over-the-counter aspirin, can cause people to bleed easier. So before you do a venipuncture, you want to be sure that you're asking your patient if they are taking any of these medications. And you may have to apply pressure a little bit longer to control bleeding when you draw from them. There is actually a condition of anemia, and anemia is when you're low on hemoglobin, low on red blood cells. But we can cause a patient to be anemic from doing too many venipunctures or drawing off too much blood. And the name for that is iatrogenic anemia. So if you see that term, you know that patient is anemic, but it's because of lab tests that have been done repeatedly on this person. So some disorders of your cardiovascular system: congestive heart failure, that's where some part of the heart pump is not working very well, and they may start to retain fluid or have swelling. You can have valve problems. They may not work and cause your heart to leak blood. And you can have vessel problems like a stroke, CVA, an aneurysm. You could hemorrhage. You may have atherosclerosis, hardening of the vessels. Or you can even have ischemia, which is damage to the vessels. We've talked about polycythemia and anemia and leukemia, so you know those are blood disorders, and you know what each of those mean. And you know how hemophilia, an embolus or a thrombus, those are clots, can cause problems with homeostasis. DIC, disseminated intravascular coagulation, is a condition that happens to pregnant women very frequently during labor, and it can be life-threatening. Their blood gets all out of whack and they start forming clots, and it can be life-threatening for the mother. So these are some common medicines for the cardiovascular system. And here are some good examples. The picture on the left is a traumatic hematoma, a tumor of blood. And that on the right is a hemorrhage. And I have seen patients that the blood pressure cuff has been pumped up too tight on them that causes them to hemorrhage, and it looks very similar to what that picture looks like there. So if you're doing labs on the cardiovascular system, you may be looking for red blood cells, how many there are, what do they look like, what is the hemoglobin, how many white blood cells are there, what does their bone marrow look like. So you may be drawing whole blood, or you may be doing tests on the plasma or tests on the serum. Whatever test you're doing is going to determine what color tube you use to collect your specimen, and we'll get into that more in a later chapter. Remember that a CBC is a complete blood count, so it tells how many of every type of cell that you have. And you can also order a differential on that, which will tell how many of each specific type of white blood cells you have. Blood banking, that's the special area where the blood is taken and tested before it is transfused to another patient. So that's a different area of the lab. And then there's also the chemistry portion of the lab, and that's where we would test things like sodium and potassium and chloride. If a patient were dehydrated or having excessive diarrhea and losing lots of fluids, their electrolytes could be all out of balance. So they would have lots of chemistries drawn, different tests to test their chemistry level. These are the different parts of your lymphatic system, and your lymph system helps circulate fluid all over your body. It helps carry it where it needs to go and carry it away from places where it doesn't need to be. You have lymph nodes and lymph vessels all over your body. So there are more graphics. That's why if you go to the doctor with a fever, they palpate all of these areas to see if you have any lymph nodes that are swollen or enlarged, or if you have infection in any of them. So the main purpose of your lymph system is to help protect you against disease and maintain your fluid balance. It also helps you absorb fat and nutrients from the food that you have ingested. So the circulatory system and the lymph system work very closely together. You transport about 30 liters of lymph fluid through your body tissues every single day. So it is constantly working and shunting fluid from one place to the next. If you have lymph nodes removed for whatever reason, for example, if a woman has breast cancer and they take off her right breast, they're also going to take a lot of lymph nodes with it. So if she doesn't have her lymph nodes there, she may have trouble moving fluid through that area effectively. And a lot of times it's very common to get a large amount of swelling or lymphedema on the side where a woman has had a mastectomy, or if she's had lymph nodes removed from another part of her body. So one way we can treat that is to teach her to do exercises and maybe even wear compression garments to help that fluid travel back towards the heart so it can be pumped out. You can have tumors or other disorders of your lymph system, and you can even have infection in your lymph system. So here are some examples. That picture B up there at the top is lymphedema, and you can tell that's not normal looking swelling in that foot. That is very excessive. D is a skin lymphoma. B is chronic lymphedema. A is lymphanginitis. And then C is a lymphoma, tumor of the lymph. And if cancer gets into your lymph system, it pretty much can travel anywhere in your body. So that's why lymphoma is a very difficult type of cancer to treat. Some tests you may be asked to perform regarding the lymph system would be bone marrow samples, blood samples. Sometimes they will remove a lymph node during surgery and it will have to be tested. So this is some medical terminology related to your cardiovascular and your lymph system.